Okay. So thank you everyone for joining today. And we'll start with the round of introductions. This is a learning webinar which we are doing for our microgrants. And I'll give a brief introduction and we'll start with the introduction of the microgrants and everything. But first, let's do a round of introduction because there are some colleagues who have joined in TCI and we have not interacted before, like on this, and we don't know each other. So it's better that we do a round of introduction. So I'll start with myself. My name is Vakar, and I'm working with TCI as Senior Programs Manager. Most of you know me. I have been like member of TCI since 2014-15 and joined TCI Secretariat to support the programs works in 2021. I nominate Richa now to introduce herself.
Hi, everyone. My name is Richa. I'm with TCI as a research and advocacy officer. I'm from India, but I've been in UK for the last 2 years now, so that's where I'm working from. Nice to meet you all. I nominate Kim.
Thank you. My name is Kim. Actually, my real name is Kurwan, which is hard to pronounce. So I will go by Kim. I have been learning a lot from TCI capacity building projects. And one time I learned from a fellow member of TCI Asia from Korea to write CRPD parallel report. And we did quite well on it. I also share an organization of persons with psychosocial disability in Thailand called Living Association, as you see in the background. But I am 70 years old, but I am still learning things because I don't know much about how to work in this area. And I'm very glad that I meet TCI and learn from people in TCI Asia. Yeah, thank you. I nominate Melly.
Hi, I'm Melly. I'm from Imphal. Okay, I appointed David.
Hello everyone, my name is Ratna Dewi from Indonesian Mental Health Association. I am as head of Jakarta branch Indonesian Mental Health Association. Thank you.
Good to see you, Ratna.
Itu Tiza.
Okay.
Hello everyone, my name is Fiza and I recently joined TCI as Programs Assistant. It's been great knowing you all and I look forward to seeing more of you guys, and now I nominate Aisha.
Aisha J.
Aisha, are you there?
Aisha is from
Miasa.
Oh, right. Okay. She's saying
her
that
mic's not working.
Okay, so Anita, you can take from here.
Okay. All right. Assalamualaikum. Very good morning, afternoon, everyone. I'm Anita from Miasa, Malaysia, the Mental Illness Awareness and Support Association, Mental Health Advocacy and Peer Support Group. Very, very happy to be here today. Really want to learn from those of you that have conducted the research project as well, to see where we probably overlap and what are maybe some new things that we can learn from the other countries conducting it. And I would also like to take this opportunity to thank TCI IDA very much, because as what Kim just mentioned, we've learned a lot from being with TCI since 2018, and really Wakar, Richa, and Fiza just wanted to share really quickly that although I have never had the opportunity to be part of the big bridge training, but I was able to present on UNCRPD during the World Psychiatric Association's World Congress of Psychiatry in Bangkok. So I was really, really happy to be able to do that, provide a voice so that at least the mental health professionals can do something about it. So thank you so much, TCI. I truly, truly appreciate it. The capacity building has been great. We have been able to do a lot of things through, learnings from whatever TCI has been supporting us with. So thank you so, so much.
Thank you, Anita. Thank you so much for this brief introduction. You want to nominate somebody else?
I think everyone is
done, right? Yeah, okay. That's perfect. So just to share, like TCI started with the microgrants program in 2019 when there was like COVID-19 pandemic, and we completed a full cycle of microgrants for it was also a 6-month cycle, and we completed that in 6 months. It was specifically to to respond on the COVID-19. We wish that we don't get to see again such pandemics in the coming future. It was really hard time for the world, and thank God that we are back to the normal and people are vaccinated. So we as persons with psychosocial disabilities were not involved in the policy discussions and the COVID response. We were left behind during the policy discussions. We were left behind in the response programs, in social protection schemes. People with psychosocial disabilities living in institutions were at a greater risk. People were losing jobs, and we were unable to access the services which were available in the community. And to address this and work with with our members of TCI, we piloted the first microgrants program to respond on the COVID-19 pandemic. And after that successful cycle, TCI planned an ideation, and we did ideation on that. And we plan to do the second microgrant cycle for 2021 and 2022. So our dearest micrograntees here, I express my gratitude, and I thank you all for being part of this microgrant cycle. This year, the purpose of TCI microgrants. So first, I'll come to like what is like behind what is our objective behind providing microgrants. The purpose of providing microgrants is to empower the organizations of persons with psychosocial disabilities and build the capacity of our members who are member organizations, and most importantly, to provide an opportunity for TCI members to mobilize and build partnerships with various stakeholders at the national level, including the NGOs, including the governments, the cross-disability organizations, to take initiatives relevant to advocacy and to advocate towards the inclusion of persons with psychosocial disabilities and involve people with psychosocial disabilities in the overall development process at the national level. So this is one of the like key objectives behind TCI microgrants. And this year we focused to do situation analysis in different countries. So the idea of doing CITANs for the national level on key issues was coined in the Secretariat, as when organizations or an individual who is doing a CITAN, there is a need for that person or that organization to mobilize at the national level more and more, interact with people, have dialogues with people with disabilities, and it gives an opportunity to, to interact and mobilize at the national level and compile the different experiences of people with psychosocial disabilities. So this year we plan to do the SITANs because there is an opportunity for doing key informant interviews with the government. There is an opportunity for meeting different groups of people with disabilities, meeting different stakeholders. So yeah, and our thematics, we draw the thematics from the previous TCI and its members discussions. Like we had gender and inclusion, inclusion of women with disabilities and non-binary persons with psychosocial disabilities. We had a thematic on building community support systems. We had a thematic on social protection, disaggregated data, COVID-19 and DRR, employment and livelihood opportunities. So these were like some key thematics which we provided to do the SITANs at the national level, as we know that these are some of the key topics for us. So now, I'll open the floor for all of the grantees who are here with us, and we would like to hear from you. We have got your reports. The reports are super amazing, beautiful reports, well written, and almost everything is covered. The what you have done in the situation analysis and with regards to your key thematics which you have chosen to do the micro grants. So we would like to learn in this webinar, like how the SITAN has supported your organization at the national level towards a plan of advocacy. Like Kim was sharing with me that there is a law being passed in Thailand, um, which will restrict people with psychosocial disabilities to have access to government jobs. So I think here it is very important that using the and luckily Kim did a SITAN on employment opportunities for persons with psychosocial disabilities. So I think it's one of the it's important that and it's very helpful, like using the SITAN on employment opportunities and repealing the law which is government is yet to pass. So we'd like to learn about your advocacy plans and how this micro grant opportunity has built the capacity of your organization. And thirdly, when you were doing your projects, whenever we are also doing our projects and we are doing different programs, we face challenges, we face difficulties. So what were those difficulties and how you plan to address those difficulties? Were there any alternative ways which you choose, or you took some solutions? So these are some three like key areas which we want to hear from each of the organization to document it and prepare for the next microgrant cycle, which inshallah, hopefully we will be starting in the beginning quarter of the 2023. So I would should we go like do you want to raise your hand, or which organization wants to go first, or should I like say off?
Can I go first?
Yes, yes. Thank you. The most senior can go first.
So I
Over to
won't
you,
be
Kim.
nervous while listening to others.
Over to you, Kim. So you, like every organization
you.
can take like 15-20 minutes.
Thank
you
you.
have like
I will be short.
Yeah,
Can I share the screen?
yes, you can share. I'll give you the screen sharing rights because there were like other grantees expected today to join, but they have not joined us today. So we have an ample time. So it's up to you, like how much time you want to utilize. Over to you, Kim.
Thank you. First of all, I would like to say that I will say talk briefly about our experience. Our experience mainly about providing services to services in developing well-being to the people with psychosocial disability and person affected and who have mental challenge, and also their family. But this year, Microgrant really challenged us to do the SITAN, right, situation analysis. And at first, I wonder how we're going to do it, because we have little background in research. And so it is good that TCI said that we can hire some researcher to help us. And we did. And we also, but we find that this is also another challenge, that the researcher do not really have the same level of understanding about human rights-based kind of approach to the work of psychosocial disability. So we have to talk a lot, and we also have to sort of like after the situation analysis has been written to the full version, we have to talk again and then research some more and redo it in a in a more targeted way to our employment themes. But doing situation analysis really help us to see the picture. We got some good statistics to base on when we do our project. And also we have the chance doing the focus group, we have the chance to connect with different people from various work. Like we connected with student advisors and counselor, with a therapist, and people who work in research about employment of people with schizophrenia. And we also talk to psychiatrists and also people who have mental challenge experience. And so we compile the situation analysis from that, and based on the research of literature as well. So in advocacy, we have created a webinar, and the challenge was that the COVID Omicron came just in time when we were going to put up a webinar. And then we have to do on a Facebook Live and Zoom. So we from that challenge, we have to learn new skills in doing live Facebook Live and meeting in Zoom all together. And we find that it was quite good, because it can go to it overcome the distance. People in the upcountry can also listen to us and get in touch with us. We also have online training course, and it is for developing the well-being. I call it in Thai, development of well-being. which I will show you some of the pictures. This is the focus group we have, we held online, and we talk about many things. And this is the part of art therapy that we offer online to the people around. And we found that even though we were in much distance, a great distance from each other, we felt a very good connection and a community of a safe community for all the participants. And we also offer illness management and recovery online, also another course. And we have, I help taught about good society, which is democracy kind of society, and where people have good governance, and also legal state. It is a legal state, and so we learn how what are our rights, and also how to be a good citizen. And another things is about life skill. Life skill we concern about inside, like motivation and attitudes and things like that. And also outward kind of living, like time management, stress management, and also job, work skills and things like that. As you know, Ikigai. And this is communication skill. We based on nonviolent communication. This is the webinar. We work for inclusion was our webinar, and we have speaker from researchers, people who hired, people with psychosocial disability, and also people with psychosocial disability who works. And we have a very good sharing. In advocacy, we also learn about advocacy, the techniques and the skill. And so all these the courses that we taught online, and so that's about all that we have done. I think if you are interested, I can share with you the summary of the webinar, and also the short version of Sitan situation analysis with you to see the condition in Thailand. But the most striking things that I learned is that people with psychosocial disability registered and certified as people with disability in a very limited number. And in that limited number, about 75+ percentage are in working age. And from this working age, about 160, 20,000, only 1.5% are employed. So we have great work to do in this area. I think we have to advocate for much employment opportunity. And what is worse is that on the 20th September just recently, the government passed a law, approved a law that say that people with psychosis and mood disorders who are in severe and chronic condition, who cannot work, cannot be accepted to be the government official. We are just shocked because it came out very quietly, and the media read very little cover it, you know. So we just read it in the government weekly report only. And then, so we are moving right now. We have to work very hard and in a very quick way in order to repeal the rule, you know, the law. We talk to them. We talk to the civil organization of the government, and we also maybe we have to go to court in order to repeal the approval. And but we also find quite a few alliance in many sectors to help us. And Waka just suggested to me that we should connect with UNCRPD. And I appreciate that TCI will offer this opportunity to us to so employment is very crucial and very in need of advocacy in Thailand right now. So I end here with my appreciation for your attention.
Thank you so much, Kim, for this brief overview of the work which you have done under the microgrants. I think it is key to advocate with the government, and it's the right time that you can say that there are ways to include people with psychosocial disabilities in the communities. You are doing a lot of good work on community inclusion, and it's just about awareness to the government and advocacy with the government. I think I wish that the law doesn't get passed, and so this is why we are now focusing more towards community inclusion and how the governments can include people with psychosocial disabilities in the communities by providing, say, social protection, by providing, say, personal support systems, peer support, different alternatives, different therapies. There are ways like to include people with disabilities, peer support, friend circles, and family. Family is the starting point. So we need to do a lot of work on this, specifically on community inclusion, how this can support. So yeah, we will carry on with that. Thank you so much, Kim. So we'll come back, like we'll do the question answer session for the cross learnings. We wanted to have this webinar so between all of us, and we didn't go for individual because it's an opportunity for everyone to learn. And it's just our group, it's our safe space, so we are learning from each other, and there will be a lot of cross learnings also. So feel free, if you after the presentations, we can do one, like, say, small dialogue between all of us, if we have any questions ongoing and we want to ask something from the other country. We can do that cross learning session after the presentations. So we'll move to the next presentation. Who wants to go next? Miyasa, you want to go?
Yep, I can. Can you
Hello?
hear me okay?
Perfect. Yeah, I can hear you loud and clear.
Okay. All right. Thank you. Thank you very much, Wakar. Thank you to the TCI team. And thank you, Kim, for sharing that. Good job. Great work. Congratulations. Yeah. I mean, you know, even for us, when we first decided to proceed with the site and analysis, we've never done, just for everyone's information, we've never done a research project independently. So it was really a big milestone for MIASA to be doing this independently. So it was just our team, and we had probably about 20, 30 volunteers helping out. So these volunteers came from various backgrounds. Obviously, a majority of them were people with lived experience. So we had our peers, caregivers, and just, you know, mental health advocates, you know, so professionals, you know, etc., coming in to help out. And I think one of the things that for me, at least, it was very validating to be able to do this project because, you know, we have a lot of anecdotal accounts, Ken Kim, you know, when we go through all these, you know, experiences, we hear, you know, grievances from, you know, from our peers, but we've never had a way to document it. So this was really, you know, a way for us to enable us to do this. So this was really, really good in that sense. And, you know, being able, you know, Wakar, like you said, having the dialogues, right? You know, even for me, I moderated many of the sessions, you know, the FGDs and also KII. And I've been in a lot of FGDs, but, you know, moderating it and with the themes that, you know, we're really passionate about, it's really different. So that was really, really nice. So thank you again for the opportunity. So we selected two themes, theme number 2, which was building community support systems, and theme 6, which was Thailand employment and livelihood opportunities. And the reason why we picked these two themes was because obviously these are, you know, mostly the grievances that we hear from our peers, and we wanted to learn more so that we could work on, you know, policy recommendations. And again, just for everyone's information, being MIASA, we are very involved with the government and being involved in the sense where, you know, anything pertaining to mental health, MIASA has, you know, a representation. So we're, you know, always in dialogues, you know, we're also part of the advisory council for mental health where, you know, our health minister chairs it. So, you know, I have a direct voice. So I have that link, you know, in a lot of things, even in our, you know, roadmap to mental health for Malaysia, even on our transformation for mental health, you know, we're very involved. So we really needed this project so that we had this, you know, empirical evidence, you know, because it's, you know, I've been in a lot of, you know, settings where people tell me, oh, but that's anecdotal. And, you know, I sometimes I feel like it's not, you know, it's not in the sense where we hear it repeatedly, right? So that's why this project was so important, right? Richa, Fiza, you know, Wakar and everyone. So I think that was really helpful in that sense, and why this research project was very meaningful for all of us at MIASA. Okay, so that's in terms of the experiences, but obviously when we were going to, so now we've got the approval and we can do the site and project. We didn't realize the preparation that it took to do the project. So that was the challenge. And I think the timing was also a challenge, you know, Wakar and everyone, because it was already November, December, and, you know, people started traveling. And then we didn't, you know, anticipate, well, there was actually a lot of preparation that needed to be done. And we didn't know this, or we didn't, you know, anticipate that preparation part. So I think only in January, we were able to really kick it off. But it was good in the sense where it gave us time to really prepare the questions well, to really market it, getting or identifying the participants that we wanted. So we had, you know, our peers, caregivers, we had various stakeholders, NGOs, DPOs. We also had many, well, not many, several from the corporate reps, which were, you know, some big shots, which we were really happy about that, because we really want to hear from the very top, right? You know, what is their challenges? What are their reservations? Why do they not want to hire people with, psychosocial disability, and even PWDs for that matter, right? What are the reservations like? So, so those were some of the things that happened throughout. I'm just gonna, Wakar, if it's okay, can I share my slides? That way it gives me a little bit of structure when I speak. Okay. Can you guys see my slides? Yep, okay. Okay, so just really quickly on numbers. So we did, because again, we didn't have much time, but hopefully this was, sufficient for TCI and also IDA, that we had, for theme 2, we had 79 people, and then for our participants, and then theme 6, we had 61. It's quite balanced in terms of, the NGOs and the people with lived experience, which we really like. But of course, it's always heavy on females. That always happens in, anything that we do, really. And then after we conducted the FGDs, the KIIs, concurrent to that, we held the advocacy seminar. So we managed to do 3 advocacy seminars, one in February, March, and April. And we had, the 3 advocacy seminars targeting 3 different groups. So the peers and caregivers were in one, the NGOs and various stakeholders in one, and the rest were for the corporate, team. Or organizations. And we covered basically on the importance of advocacy, the strategies in, advocating, whatever cause it might be. And then we wanted to highlight on stigma, discrimination, and human rights abuses and violations. So we spoke about that heavily in our advocacy seminar. So that was a big chunk. And then the rest was on it was preliminary research findings, because again, we completed the project in April. So, as we were doing the advocacy seminar, we only had the prelim findings. So that was what we presented during the seminars. And to be honest, during the seminars, it was really nice because at the end, what happened was it was more of a dialogue. So we were able to hear on the other, either advocacy groups or people that were interested in doing advocacy, what their challenges were, what worked for them and what didn't. So it was like a shared learning at the end. So that was really nice. So when it comes to our findings, so on theme 2, which was the building community support systems, one of the things that we always hear a lot about from our peers, obviously, difficult to access, services or any kind of solutions in the community, right? And that's why a lot of, obviously, institutionalization happens. People fall through the cracks of the system, the community rejects them, and then they end up, homeless on the streets. And chronic homelessness happens a lot in Malaysia as well, because over here, like Miasa is an example, right? Just for added information, is we do a lot of outreach programs. So we go to the homeless communities and we help them out. We provide, as an example, health screening, mental health screening. We provide counseling. We give them, whatever medication they need, antibiotics or, flu meds, gastritis, whatever that they might be, experiencing. And then we connect them to social services, right? If they, for example, need social protection, or they need jobs, as an example, or places to live, that's what we do. But what is really unfortunate is it's very difficult to bring them, as an example, if they need to get, psychiatric medications, or they need to go for other kind of treatments in, clinical settings, that they're not going to take them in because in their perception is, okay, they then, get treatment, they're okay. Where do they go? They end up back on the streets. So this is one of our challenges. And so this topic or this theme was really important to us, so that we're able to fill that gaps. We know what it is, what are the challenges, and how do we strengthen and how do we expand and develop these, community support systems. Although at Miasa, we've we have a lot, we've got, peer support. We do a lot of art-based things. We've got art therapy, we've got speech, we've got drama, we got, expressive dance. We do peer support, family support, spiritual therapy. We do music, we do sports every single year. And we have our regular weekly activities. So we've already done a lot, but there's still a lot more that needs to be done. And so this was really important for us to really understand, how the pandemic, one of the striking effects, obviously, right, the huge toll that it took on the mental health of many people. So now, within the pandemic, a lot of people, find themselves with, anxiety, depression, and then using, maladaptive coping mechanisms, right? So a lot of increase in substance abuse, as an example, and self-harming as well, and suicide rates rocketed in Malaysia, which was really, really sad. And I think one of the most unfortunate things happened during this pandemic, where for the first time in the history of Miasa, we lost one peer to suicide in 2020. So that was really difficult for us. But yeah, so we're trying to improve. So this was really something that we really wanted to do because of that as well. Effects of the pandemic. Okay, lack of access to services. What happened was, in Malaysia, the first lockdown was really difficult because it was 3 months and we couldn't leave the house at all, right? So everyone was cooped up. People that were struggling, they couldn't, couldn't access any services during the time. Even Miasa, we weren't considered part of essential service, so we couldn't operate at all. And during the time, we didn't know how to do things online, right? We didn't know Zoom, we didn't know Google Meet, we didn't know how to do Facebook Live, like what Kim was sharing. We didn't know how to do IG Live, YouTube Live, And so we had to go through that steep learning curve during the time. But in reality, what happened was everything was shut. So people couldn't access these services. And then, of course, there's a huge demand for peer-run alternatives. And one of the things that I'm really proud of Miasa and what the team has done is all our programs and activities are run by, people with psychosocial disability. And, this is one of the things that for me, doing this work is so empowering. Because, sometimes when a person comes in, they're in a really bad situation, and then they just need an opportunity, right? They just need support. Sometimes people don't have support at all. And so when you empower them, because people can give you a lot of things, right? Everyone's talented in their own ways. Everyone has something to give. And when we are able to empower them, we provide that liberty, that autonomy, supporting them in that recovery process. Definitely, 100% it improves recovery outcomes, right? And so we see how, from being that person that feels that there is no way out to a person that now, is able to provide hope to other people. And that's so empowering, right? That camaraderie, I feel, is extraordinary. And so, this is one of the other things as well. And of course, greater societal awareness, right? A lot of participants have said that there's an increase, obviously, effort and attention on, awareness when it comes to mental health. And we saw that in the first year of the pandemic, where a lot of people, everyone came together. A lot of people were sharing, all these different helplines and resources on social media, because we know at our own individual level, we can do a lot of things, especially on social media, right? And even for Miasa, we leveraged, 100% on social media during the time. And during the first 1.5 years during the pandemic, we had about 100,000 people reaching out. And how the health systems were overburdened with COVID. This was how, Miasa and our friends on the ground were overburdened and overstretched, because a lot of people needed help during the time. So that's on theme 2. Now, when we come to theme 6 on employment, livelihood opportunities, in the pandemic, a lot of employers, a lot of organizations reached out, right? So there has been a shift in corporate attitudes, because a lot of employers lost employees to reduction in productivity, right? So a lot of people were struggling. So they saw, that reduction in productivity, absenteeism increased, and, a lot of anxiety and depression was happening in the workplaces. And also, unfortunately, many of these organizations that reached out to MIASA, they lost, an employee to suicide during the pandemic. That was also, one of the reasons why, this shift in the attitude and spurring that action came about. But then, of course, as we all know, and I call stigma poison, it's a true poison of it all. It's truly poisonous. And although we see that shift, but stigma is still very prevalent. There's companies where they've done EAPs, employee assistance programs, there's a shift in attitudes, but then, in that environment itself, stigma persists. And so this is what the feedback that we've gotten, and we've gotten this feedback, even prior to the pandemic, even during the pandemic. So that continues. And it's so unfortunate because every single peer that we, interviewed that were part of this FGD and KII, none of them, not even one, have disclosed their disability to their employer. So that is how much, not only how much stigma persists in the workplace, but how much they themselves internalize the stigma, right? You feel ashamed, you feel afraid, there's a lot of fear. Because obviously with stigma, then it leads to discrimination, right? And then participants also reported a greater need for supported employment. And this is one of the things that we provide at MIASA as well, upskilling and employee readiness programs, again, to improve recovery outcomes. And also not only that, obviously to reintegrate, especially those that, have been struggling with more chronic mental health disorders or conditions, to build, more meaningful lives. So just really quickly on recommendations. So on theme 2, building community support systems. So these are 6 recommendations. So the first one is increasing funding for expansion and strengthening of community-based care and services. And what we're really, really happy is, due to the pandemic, a lot of organizations now have or had the COVID relief fund. So a lot of COVID relief funds were available during the time. And, we've had our crisis helpline and crisis team for a couple of years, but only, within the pandemic, a private company came in, a huge company came in, and they funded us for our 24/7 crisis helpline, which is a toll-free number. So we partnered with Maxis, having a 1-800 number, and also Sangdabi Foundation. So they funded us. So that was how we're able to, recruit more crisis team members. We had, massive trainings, and we could beef up the team. Because at the end of the day, we have, the expertise, but we don't have the funding, right? You still can't do anything. So when the funding came in, we were able to expand it, have it 24/7, have a system in place. We could do data capturing, and we could help more people in the community. All in all, it benefits everyone because it eases the burden of the health system as a whole. And then, of course, comprehensive and collaborative awareness raising and anti-stigma campaigns led by people with lived experience, and interagency dialogues, so having, peers, people with psychosocial disability involved in, symposium forums, roundtable discussions, etc., so that we can strategize more effectively. And of course, in incorporating recognition of mental health, emotional well-being, psychosocial disability as core part of the education curriculum for primary level onwards. And during this pandemic, we see a lot of children finding themselves, struggling with anxiety and depression. Many of them, 1/3 of people that reach out to MIASA, all have suicidal tendencies, and most children that reach out all struggle with suicidal thoughts. So which is very, very sad, but hopefully we can do more. And of course, increase peer participation and involvement within policy making bodies, clinical practice guidelines, national strategic plan, etc. It can't just be MIASA. We need more voices of people with psychosocial disability. And of course, task shifting and empowering the community, because at the end of the day, not everyone needs clinical intervention. If if we can empower the community, just being able to speak to someone can already help. And of course, funding for the increased staffing and upskilling, I think that's always the case. And then going to theme 6, employee assistance programs, so that we're able to employees that are, either struggling or have, loved ones that are struggling can reach out for the help. Because again, when we make, these things more accessible, right? It benefits everyone, right? When we improve or we make things more inclusive, it doesn't just benefit people with psychosocial disabilities. It doesn't just benefit PWDs, it benefits everyone. So if we're able to provide employee assistance program, then, if your friends reach out to you, even if you yourself are not struggling or lack the knowledge, you can actually reach out via the employee assistance program, and via that you can help your loved ones. So it benefits everyone at the end of the day. Additive employee support programs where, regular town halls, employee check-in, support groups, and then having mental health breaks. And of course, continuous raising efforts, reasonable adjustment and accommodation. Again, not everyone needs it, but if you have it, people feel more supported, of course. And then, of course, insurance, which is really lacking in Malaysia. So hopefully through this, we're able to advocate for insurance coverage. And we did a lot of infographics, but this was some that we did for the site and analysis. So we have the policy recommendations, the finding and the results, and we have shared it across to WACAR as well. So I think that's all that I have. So thank you so much. Hope it was beneficial. Thank you.
Thank you so much, Anita. Thank you so much for this wonderful presentation. Like great to hear from you about the project. Almost you have like covered most of the points, most of the things which we are usually discussing on our daily basis, like in terms of employment and in terms of building community support, how best we can support the community, and what are the key areas which we need to work at the national level, at the local level to support the community, and also how we can best include people with psychosocial disabilities to have access in employment opportunities. And I think it's a great work which you are doing at the national level. It's just
WACAR, sorry, I forgot one point. I just wanted to add that through this site and project that we did, I'm sure Kim and the rest would agree with me, hopefully, that it also built a lot of confidence within us, within the team. So thank you so much. Just wanted to say that. Thank you.
Yeah, because the purpose of this microgrant process is the same, to build the organizational capacities, to build the self-confidence of people with psychosocial disabilities, to make connections at the national level, to make connections with the local cross-disability organizations, government stakeholders, to advocate for rights of people with psychosocial disabilities. And we will be coming up with like similar kind of thematic areas in future also for the microgrants, so that our members can get the opportunity to engage more and more. And when you get an opportunity to engage more, it builds the capacity. So it's just amazing, and I'm so happy to hear from you, Kim, and Kim and you. Really wonderful work. So we'll come back like on the questions and dialogue later on. We'll move to IMHA now. IMHA team, over to you. Ratna, I cannot hear you. We cannot hear you.
Okay. Hello, everybody. I will do the presentation right now. Indonesian Mental Health Association received funding to have analyzed by person with psychosocial stress for employment as
Melly, we cannot. Melly, I'm sorry to interrupt you. We cannot hear you clearly. There is a quite light of there is a echo behind you.
okay.
There is a lot of echo over there.
Hello.
Yes, it's quite clear now. Richa, is it okay?
Yeah, I'm listening.
Okay.
I'm okay on my side.
Okay, I will present the Indonesian Mental Health Association research. Indonesian Mental Health Association received funding to have Indonesian Mental Health Association received funding to have analyzed the barriers experienced by persons with psychosocial disabilities to access formal employment as barrier for advocacy. The PDP according UNCRPD. This is the result of a lack of opportunity that we have done from the person with psychosocial disabilities. The mapping of the situation of the barriers to the right to work for person with mental disabilities. Okay, the next slide. Background to the problem, Article 43 of Law Number 8 of 2016 regulates the quota of workers for persons with disabilities as much as 1% for the private sector and 2% for state-owned enterprises or government institutions. Although in 2021, the Central Statistic Agency or BPS conducted data collection related to employment which showed that there were 1,271 persons with disability working in 70 state-owned enterprises or BUMN and 4,544 people with disabilities working in 588 private companies. The quota is only met by various physical disabilities, exclude persons with mental disabilities. During the pandemic, 1 in 10,000 with minor disabilities lost their jobs due to COVID-19 pandemic, and 8 in 10 of those households experienced a decrease in income compared to before the COVID-19 pandemic. Why do people with mental disabilities get attention at work? The key question from the reason people with mental disability want to work, according to the survey, almost all people with mental disabilities said that they want to work for the reason that make money or having income, living is more rewarding, able to do or produce something, increasing the knowledge, having a social life with having a friend, living with independently, temporarily keep away from problems in the family. It shows instinctively human being wants to survive. Work is part of human right. There are 11 protection regulations for persons with disabilities working in Indonesia. Persons with disabilities experience obstacles, namely systemic barriers, the workplace environment, and individuals. Systematic barriers can affect environmental and individual barriers. Similarly, individual and environmental barriers can form symmetric barriers. There are even some people with mental disabilities who experience layers of discrimination, especially people with female disabilities. which a form of discrimination not only attached to their disabilities, but also related to gender construction. For example, women with postpartum anxiety disability who experience relapse at work because they panic about not getting a special space for breastfeeding and the lack of affordable child care facilities. For the gender burden of child care is placed on women. Systematic barriers. The existence of certificate mental health requirements in the recruitment process. In Article 65 of Law Number 5 of 2014 concerning the state civil apparatus, and Article 23 letter of Government Regulation Number 11 of 2017 concerning civil servant management related to the positions of administration, supervisors, executors, and for functional positions. As in the private sector, it also applies the requirement of the mental health. Knowledge bias of the state apparatus because you only understand the variety of physical disabilities. The government argued that there were no implementation regulations to monitor the situation to workers with disabilities, including persons with mental disabilities. Workplace environment barriers. Employers do not understand and do not want to know about PDP. Employers have not respected people with mental disabilities. Employers prioritize the output of products that can bring profit regardless of situations and conditions. In fact, not notifying the condition of the diagnosis because of fear of not getting a job so that it often causes relapse in the work period. The case experienced by the DN state civil apparatus in the Ministry of Finance when relapse did not come to work. DN initial. DN is the initial of the name of the employee in the finance ministry. So the career position are not decision-made employers who knew the workers diagnosed did not give the position of decision makers, thus making the PDP uncomfortable and restrained. PDP workers who are in a decision-making position because people with mental disability hide their state of disability. People with mental disability work on social issues or in the place of relatives who are already know their condition. People with mental disabilities are the owners of the workplace. 3. Stigmatization of people with mental disabilities. 4. Unbalanced wages. 5. Vulnerable to being a victim of violence like bullying, rape, jokes, etc. For individual barriers, the impact of the absence of support mechanisms on the PDP has created a layer of insecurity for PDP individuals, namely the difficulty of communicating openly, concentrating and completing in a short time. Evidence for advocacy, the result of this study has become a reference in the joint advocacy of the Jakarta Legal Aid in the case of state civil apparatus who was fired by the Ministry of Finance and finally won. Mainstreaming mental health to public and stakeholders, non-BPOs, regional people's representative council, presidential special staff, etc. The results of this study became the basis for arguments for advocacy of Jakarta Regional Regulation, law on the elimination of sexual violence crime, especially at the workplace. Okay, thank you for the presentation.
Thank you, Melly. Thank you so much. We'll come back to the dialogue session after the presentations. Luckily, Bob has also joined. So this year, the focus, like when we went TCI Global, so we thought to give away one grant or a couple of grants to the African continent as well. And Bob was one of our members. He has a physical disability as well as a psychosocial disability. He has joined for this webinar, and also he's joined the TCI membership in January. So Bob, you want to introduce yourself, your organization, and then you can start with the presentation.
Yeah. Thank you so much. My name's Bob Lubega. I'm working as the executive director at Rights for Disability Development Foundation. First of all, we are going to be very brief, as I informed you that we have a very urgent meeting somewhere. So we are going to be very brief, and I want to thank you so much so that you have considered us so that we can at least present our sit-and report immediately. So as RDJ, we did our project in Namayumba with a number of 71 participants, where we did well. We have some experiences concerning on that project during the implementation, and we have capacity building experience or capacity building support, which we got from the implementation of that project. And we have some challenges which we faced during the implementation. First of all, we want to start with the experiences which we got during the implementation. Actually, most of people with the psychosocial disabilities, they were not really knowing themselves, and they even didn't know where they get their services. And even in the community, this community, they didn't know that they have such people with the psychosocial disability in their community. So we actually saw that this project which we implemented, it gives them more to know that these people, they are among them, and they had to be sensitized very well so that they could understand that in our community we have such people who are having such a disability. And also an experience which we had in this implementation, we saw that people with psychosocial disability, they didn't know that there is other programs which can be able to cater for them, the development activities. So they didn't have such idea concerning about it. So when we came in and trained some of the international instruments concerning about the disability, they really knew that they can use some chances which come in the community so that they can be able to get such support in different angles. So on capacity building, RDJ really, this project supported it so much concerning about to know how to, more knowledge on how to keep bookkeeping, and also to concerning about financial literature. This was really a big support to RDJ. So when we come to challenges, we have some challenges which we faced, and even in our people with a psychosocial disability. Some challenges we are concerning about services to the people with psychosocial disabilities, because these services, they show that they are very vital to them. And when we come in, we highlighted concerning where they can get these services. Most of them, they didn't know that these services is existing in a different areas. Maybe my colleague can also have something which he could
Hello, esteemed colleagues. My name is Wanapapa Joe, working as a programs promoter with the RDDF, and I'm happy to meet all of you again, as we have always met with the TCI. We thank you so much for the wonderful support that you have given us to enable us implement this CITAN-based project. I think, as Bob has rightly put it, the major problem, the major issue with the person with psychosocial disabilities in the Mayumba community, where we have been implementing this project, is that, first of all, they themselves did not know that they have this challenge. And on top of that, they also did not know that there are services for them. So they were just left in the communities and the homes like that. But when we came in, good enough, some of their support people came and attended some of our trainings, and then they ended up bringing them to the trainings, and they were shocked to learn that, you know, there are services where they can benefit. Good enough, they have become interested, and one of the major successes I think we have scored is that awareness raising has been registered and scored out of success. Two, then we are now getting inquiries. The people themselves with psychosocial services are inquiring, where can I get services? Maybe where can I get services for education, for self-development, for employment and self-employment, for things like, and now they want services like, where can we get screening, where can we get rehabilitation and similar support. So this to us is a very good eye opener, because now we're having people with psychosocial disabilities being able to participate in inquiring and even trying to access the services. So right now, one of the key issues now we are focused on is to remain together with TCI, so that we can together see and plan how best we can enable this community of psychosocial people to access a variety of services, e.g. screening, rehabilitation, and health, because they can access places where they can, like if the health, we have what we call in our communities, we have what we call a health center 4. These are at the sub-counties, administrative units which are below the district, where they can be accessing this, like drugs, things like that. So we are really grateful that we're in touch with TCI and we are moving together. I think together we can come up with strategies of how to ensure that we can access most of these services to our people with psychosocial disabilities. When you look at the London Global Summit on Disability, the issue of inclusive education, inclusive employment, and even harnessing ICTs, these are very pertinent issues, and we are working together to see when people with psychosocial disabilities can also get modern, because they are human beings, and since they are human beings, they need to access these things. Then they will also, become sophisticated and even participate in life like other non-disabled people in the community. That's what we want, and that's why we are saying that let's stick together with the TCI, and we are happy that we are together, because in the recent regional conferences, TCI was very much in together with us, with other DDF and other partners, and we look at this as a very good opportunity for us to forge a joint effort to see how best we can bring out these people with psychosocial disabilities to reach levels of good and sustainable development. Thank you so much. Maybe Bob can add something if you.
Yeah, in fact, another thing which I had forgot concerning about capacity building.
No more to forget.
You know, we have been working with the community and also the community leaders. So when we got this funding, actually we got more knowledge on how we can work with the community so that this community and the community leaders could understand the person with the disability and in a person with the psychosocial disability and a person with the disability in general. So we actually got that experience through implementing this project. And even another challenges which we faced during this implementation of the project. Most of the parents in the community, they couldn't understand how they can identify their child who have that disability. So when they came in this project, they were trained very well so that they can understand how they can identify these children with psychosocial disability. So in fact, we also, concerning with the experience, we also knew that most of people with the psychosocial disabilities, they couldn't understand themselves. So this is a very, very experience which we saw that even other disability people, they don't know where other fellow disabilities are. So we had to share, to tell them that you have to share your contacts with your fellow people with disabilities so that they can understand each other, so that they can share experiences to each other, so that they know that they are not alone. They can also share some development information which is moving around in the community.
Supplement.
Yeah.
Thank you, Bob, for that supplement. That experience is worth noting because we have got experiences with people who have some time back who had HIV, and many of them were losing their lives. But the moment they came together and began supporting one another, and also began getting support from other members of the communities, simply because they were working and providing valuable services, they really sustained their lives and the death rates reduced. So we also think that if we follow this model, persons with psychosocial disabilities will become more active in society once they are in touch with themselves, other persons with disabilities, and even the mainstream community. Once they have that mutual support, they will be able to stand up to become more independent and live longer and have more sustainable and rewarding lives than if they were just isolated. Mutual support is a key factor in uplifting disability to greater heights, such that the sky is the limit. Thank you.
Okay. So, and another challenge, in our community there, as we people with disabilities, sometimes we can book a venue. When you book a venue, some people out there without disability, they always ignore or discriminate our activities. Sometimes you might book a venue, and when you reach to the venue, you find that it has been taken away to other organizations, the big organizations. So this experience, we faced it So this means that we still lack awareness in these people so that they can understand people with disabilities, so that they can give respect to our events or functions in their community. So that is another challenge which we faced. But we good enough, we managed to discuss with the owner of the venue. They managed to understand us very well. So that is a very big experience which we faced, and we think that we still need to make awareness raising to the community about people with disabilities.
A moment, just as a supplement, actually these people have apologized to us, the venue people apologized, and they promised not to let such a thing happen again, because we told them that, look, people with disabilities are just people like other people. These disabilities could be or could happen to anybody with this increasing rate of accidents that we face. So they have been able to understand and they have apologized to us, and they are willing to correct the situation. So we hope that next time we shall enjoy that non-discriminatory approach whenever we book space. Yes, thank you so much, and we thank you for listening to us. And Bob, maybe if you have something, kindly add.
I just wanted to thank you so much, and we hope to work with the TCI. As we informed you earlier that we are going to be very brief. Otherwise, we had a lot, but because of another meeting which we have. Thank you so much.
Thank you, Bob. It was really nice working with you as a new member on this first opportunity, microgrants opportunity in Africa, in Uganda. So just to share that Bob is based in Uganda. So we have a very little time left with us, and some of our colleagues also want to leave for other works, like Bob has some urgency,
Yes.
Anita has some commitments. So I will now move to the dialogue session. If Richa, you want to take over from here, we'll just discuss if there is any questions regarding the microgrants which we have, like from other organizations, or any other questions, Richa, you want to put up, like what were the learnings, challenges? You can take over from here. Thank you.
Yeah, thank you, Akar. Yeah, thank you so much for everyone for just being here and sharing these details of your project, because we've read the project reports, but just listening to you all just gives that richness and nuance to our understanding of the entire spectrum of work that has been done through implementation of these microgrants. And just continuing this discussion, I think if you must have seen the agenda, we had put the last half an hour as an open dialogue, and we just wanted to understand that a few key learnings for each organization, or a few major like takeaways for you from this entire process. So you can talk about what you've learned for your own organization, for your own national advocacy work, for working in your communities, maybe even key learnings from implementation of the microgrants. So anything that you would just want to kind of highlight as a key learning, you can share that. And then after that, we can just like have questions if anybody has questions apart from me. So we can also kind of have those question answer sessions. So I'll ask like anybody who wants to go first, or we can start in the same order that we started before. Is that okay with everyone? Wakar, you have your hand raised.
I just wanted to say one thing. It's not relevant to the points which Richa has made. I wanted to take a group photo. So before you leave, please stay here. And before you leave, just tell me that you're leaving now, and we'll take a group photo. So yeah, I'll now request carry on with the discussion.
Thanks, Wakar. So yeah, so for the key learnings, anybody who wants to go first, or should we start with Kim? Okay, Bob has raised his hand. So we'll start with Bob.
Yeah. Yeah, I'm with Bob, and he's Bob, I'm Job, so it can easily mix up.
Yeah.
But the thing, we have some key lessons that we would like to share with you. And given the successes and the challenges of this work, we learned that one, consultation is something very, very important, because, and never let it down. Whenever you consult, it helps you to get a background, to get a picture of what you are going to go through, so that you minimize the rude shocks that you'd get in the field. Like now, this issue of people discriminating against us when we book space and they give it to other people. You know, we went inquiring, why is this happening? Then some people were saying, oh, you know, some people were underlooking person with disabilities, they think you don't matter. But now, so we are able to understand, then we're able to share with these people. Consultation is very important. Another thing is to persist, to keep persisting. You come and do something, then if it fails, you don't give up. You keep trying, you keep trying. So like now, most of our persons with psychosocial disabilities, they are slow in understanding some things. So you keep sending the message, and then you keep talking even to their helpers, so that the helpers also can share. And as you do that, it helps to drive the message home. Okay. Then the other aspect, apart from consultation and the perseverance, you also need to be very courteous, very cheerful and receptive to people. Be always welcoming to them. Don't be judgmental. Show understanding. You know,
Yes.
so that when someone maybe does not understand something, you know that this is a person with psychosocial disability and his capacities are a bit weak. So it will take them time to know. So you have to show understanding and patience. Then the other thing is exposure. Expose them and help them from what you know, from what we know. Say, for example, if in timekeeping, if they come late, kindly don't blame them, but tell them, now, look, coming late, thank you for coming. You first thank them for having made it to the venue. And then you say, now, but now next time, try to see if you can keep time, because timekeeping is a very important factor. They understand, but if you don't expose them, they remain unknowing. Then the other aspect is what we call ongoing support. Once you get someone into a situation, make sure that there is always support to keep them encouraged and motivated. Because we as human beings, actually, it is a general rule across all humanity. Motivation and continuous support play a big part in enabling people to perform and show ability. You see, so those are some of the key lessons we have learned. And then also to accept someone as they are. Don't say, okay, so and so he has come late. I know this is a person with psychosocial disability. No, you know that this person is different, but she is a human being like any other. And given their weakness, given their disability, they are expected to manifest or to show certain type of weaknesses. But these weaknesses are there to be understood, not to be used as yardsticks for blame. So those are the kind of lessons we have learned, and we are happy that we have discovered them, and we are willing to go ahead and work as a team, to use team approach other than working in silos. What we thank for to work alone. We want to work as a team, so that as a team we can always share whatever experiences, share whatever learning lessons there are, and then see how best we can work together and move forward to greater heights of success. Thank you so much.
Maybe to add on one, also to give opportunity to him or her, so that he can express him or herself on what he's thinking, because you never know what he might talk. You might get something good from him, so that you can build on that information which he has given you. So we learned that you have to give opportunity to that person, so that he can
work as an empowerment process.
Yes.
Yeah.
Thank you.
Thank you so much.
Thank you both of you for sharing those personal reflections. So we'll go on to Kim next. Kim, if there are any key learnings you want to share.
The key learnings, as I reported before, I see the needs of Thailand concerning person with psychosocial disability. The first thing is the lack of research. Like when we do situation analysis, we find that there's not almost totally zero researchers talking about employment of a person with psychosocial disability. And we do not have what we call disaggregated kind of data in order to know the real situation. That another need is the opportunity. Since we cover the study about employment and education and healthcare services, and we find that for employment and education, there is the lack of opportunity. There's a lot of barriers, especially stigma that prevent people from getting job. And for education, there's no mention of student with psychosocial disability at all, you know, but they will, they are hidden behind the people they call like family problem, drug addiction, gaming and gambling and things like that, which poverty also, which I feel that I see that these people have psychosocial problem maybe, but they are not supported because in the law there is an article that say that people with disability will have support in the university or in the school. But since they are not identified as people with disability, so they have no access to the support that they need. They just drop out, and a lot of students drop out. Another thing is the access to their rights as person with disability, like cash transfer or free transportation and things like that, because there is the problem about getting certified. Maybe the stigma prevent themselves to decide not to ask to be certified. But at the same time, the doctor also have the idea that to be certified as person with psychosocial disability is stigmatize them. So sometimes they wouldn't allow, or they see that people with psychosocial disability has to be totally incapable of taking care of themselves, not be able to taking care of themselves at all. Then they will certify them as people with psychosocial disability, which is very inaccurate in my idea, in my sight, and prevent them from getting help. They are not getting the support they need. And also there is the stigma also prevent them from getting early intervention or community, and there's no services in the community. So when we do the focus, we did the focus group and we research the literature. We see this picture, and so we think there's a lot of work to do in this category. And also another things that we learn from doing microgrant too is that we learn about using technology, especially social media, which is very new to us. We also learn to connect with people with various disciplines and people who involve and who care about people with psychosocial disability in the society. And these are my key learning. I may add some more if I can think of it right now. That this is all I can think of it right now. Thank you.
Thank you so much, Kim, for sharing those. We'll move on to Anita.
Thank you very much, Richa. Sorry, is this just for this project or for both that we did on the microgrants, on the learning?
You can talk about on the key learnings from implementing this project, as well as what you like really, if somebody has to ask you the key takeaways. So for the implementation, yeah.
I think although we've done, this work for a while now, is that we don't know everything. I think that's one of the key things that we've learned through doing this Saitan project. And also some of them that participated in our either the FGDs or KIIs, this was their first opportunity to be able to get their voices heard as well. So that was really good, because some people are not, because we did it in really small groups, the FGDs, and we wanted to keep it that way, because we really want everybody to have, the opportunity to really dig deep into the topic, into the questions that we had. So that was really great to hear. I think that was also the other learning. And I think one of the other things that I wish we did more of, which only came about through the learnings from doing this, was the advocacy seminars, because even though we thought about the advocacy seminar, we didn't really had enough time to think about what would the structure of the advocacy seminar be, So just from whatever we could gather during that short period of time, that was what we did. But if we had more time, I have to say, Wakar and everyone, that it was quite crunch for us. And I feel just, me personally, that, even when I asked the team, I'm sure they'll agree that if we had a little bit more time, we could have maybe done better or maybe get more things in. So that was a really crunch. But again, maybe it was on our side as well. We didn't anticipate that the prep time of doing the Saitan analysis would take that much of time. And I think the other thing learning would be, I didn't realize the outcome of it would be that confidence, that it came with doing this project. And I feel more confident now in the sense where, we've done a lot of research projects, but it's always in collaboration with an academic, right? It was never us doing alone. Never knew we could do it. I never knew because I remember during the first roundtable discussion that I was involved in 2018 in Bali, that that capacity building part of it was so important, that I realized during the time, right? That, okay, this is something that we really need to work on. So we learned a lot through that involvement with TCI. But again, I think this was it. And then the other thing I think is also that opportunity to have that dialogue. So even our advocacy seminar wasn't really like a seminar. It was more about sharing and learning from each other, which was really, really good. And that is also another thing that I've learned a lot from TCI, learning together, sharing what we know. And that not knowing is also knowledge. And yeah, so all in all, it was a very, very meaningful project to be involved with. Yeah, thank you.
Thank you, Anita. Thank you so much. We have, I think, 2 comments from Wadi. Yeah, and anybody else from IMHA team? Okay, 2 hands raised, not from the IMHA team. Just taking a second to ask if anybody else from IMHU want to add on to what Wadi is already written in the chat. Yes, Melly. And then we'll come to Bob and Waka.
Okay. Okay. I want to add about this research. This research is the entrance gate to add the other rooms which is related to the right of employment for people with psychosocial disabilities which experience to have the violence at the workplace. Make us have the networking with the women organization. And the other issue with the employment welfare, such as unfair salary and reasonable accommodation, we also getting involved to have the working agreement which is inclusive for the people with disabilities. We also have the cooperation with the Perempuan Mahardika, the organization which is focusing with the employment also. Thank you.
Thank you. Thank you. So Bob has raised his hand. Bob, you can go ahead.
Okay, thank you so much. For us, we don't have any supplement, but we just wanted to request, just a polite request, so that we can leave because we have another meeting very urgent.
Yeah, so I just wanted to, before we leave, can we turn on our cameras? I'll just take a quick photograph and we can and then we can, you know, close. And
come again?
Can we turn on our cameras for the group photo?
Okay.
Okay.
Anita's chair is there.
IMHA team. Melly.
Okay.
Sorry.
Yeah. Other Verdi, I don't know, Verdi can turn on the screen or not. Aisha.
Okay.
Okay. So I'll just say 1, 2, 3, and on count of 3, I'll take a screenshot. 1, 2, and 3.
Yeah.
Thank you. Thank you. Thank you so much.
Thank you.
Thank you. Yeah.
So people who want to leave can leave. And Richa, I don't know, like if we are done with the discussion or like, is there anything we should do?
Yeah, I think everybody shared the key learnings. I just had like a couple of questions if I can ask those, and I won't take a lot of time. Yeah. So from Anita, I just wanted to ask that in the advocacy seminars, I saw the groups that were included. I wanted to ask, were there any government stakeholders included in those advocacy seminars, or because it was about workplace and employment and well-being in workplaces, which is why like corporates were included?
Yep, there were corporates included. No government agencies in that one. In the advocacy seminar, no corporates, because we did 3 separate ones. So peers and caregivers, and then NGOs, DPOs, various stakeholders, and then we had the corporate agencies. So it was both employees and employees, a management level and above. Yeah.
Employees. And what was the feedback like through these advocacy seminars, because you were presenting the research findings? So what was their feedback like when you had these seminars?
Okay, so they were very, I think it was insightful. That was what they said, insightful for them, because, you know, they never had that conversation with their employees, not in that depth. So they were very happy to be able to hear, you know, what was needed in the workplace. And then from there, they could bring it up either to the very top, because many of them came from the middle to upper management level, and then HR. So there were a couple from HR as well. And so that way they can, you know, bring it up to their very top to be able to, you know, have more reasonable either accommodations, adjustments, hiring more people with, you know, psychosocial disability, and knowing what is needed, what to do, that, because at the end of the day, there needs to be some change in the policy at the workplace. And right now for Malaysia, we're looking at a minimum of 1% of persons with disabilities people need to hire, but it's only for government agencies or the government sector. And even that, it's not enforced, so people don't even fulfill the 1%. When the representation is actually 15%, right? 1.5. So that was a really good push, and I think with what we have right now, because we have a senator that represents the whole disability group in Malaysia, and she's our patron for the alliance that we have, which I'm chairman, and so she's fully aware. And I also presented it actually last a couple weeks with the Ministry of Finance, because they really wanted to hear all these things. So that's some of the data is also within that as well.
Okay. Thanks. Because I was just thinking, because I've read the reports and I was listening to what you were describing, I was also thinking that workplaces and corporates and employers need to also be aware that there is a CRPD, which is, and has Malaysia ratified the CRPD?
Yes, we have, with 2 reservations. We have 2 reservations, Article 15 and 18, but we haven't ratified the optional protocol. Yep. And also it's also interesting. Sorry, go ahead, Richa.
No, you completed, then I'll say.
Yeah, and then I forgot my point, sorry. Oh yeah, but it's also interesting because to be quite honest, after we've completed the Saitan, because I do a lot of talks and webinars and all that, and it gave me a push to really talk about deinstitutionalization within my talks with the corporate organizations. You see, I've never done it before. I always stop at discrimination. I never proceed after discrimination, but because of this, it pushed me. And of course, after the whole DI guidelines came about and all that. But yeah, so it not only helped us to educate others, but it helped us to push ourselves to advocate for it.
Yeah, no, that's so excellent to know, because also because given the atmosphere right now, there is a lot of talks and works happening around the institutionalization.
Yes.
So even to pursue that as an advocacy point, that sounds good. I was just making this point that even in workplaces, corporates or employees need to be made aware of the CRPD, because if Malaysia has ratified it, then under Article 27, and they have no reservation over that, then they are not, they are legally bound not to discriminate on the basis of, a person identifying themselves as a person with psychosocial disability. So I was just thinking that, yes, workplace well-being, and then along with that, I hope there is this growing awareness, and awareness is raised on the point that they're not legally allowed to discriminate. That was just like what one of the reflections that came to me. So I thought I'll share. But yeah, thank you for your presentation. And one question I had for Kim. Kim, just like, because you mentioned about the law that the Thai government has recently passed, again, Thailand has also ratified CRPD, right? They have.
And the protocol.
And the protocol, because then this is just feedback, because again, it came to me while you were speaking on it, that you can use that as one of the best advocacy tools to go up to the government and say that, again, you've ratified the CRPD and the optional protocol, and then passing such a discriminatory law is completely against it. So yeah, just that thought I wanted to share.
Thank you very much. That is very helpful. Yes.
Thank you, Kim. Thank you. I think, I don't have any more questions. I had one for Bob, but if at all, if we have questions, anything related to these projects, is it okay if we email those questions to you? Will that be okay with all the organizations?
Yep.
Yes.
Yep.
Okay.
If I may ask, can I ask a question? Yeah.
Yes,
just for TCI side, what did you guys learn from what all of us have been doing through this project. Yeah.
Vakar, you want to go first?
Yeah. For this one, like, that's why we organized this webinar to learn, it's like learning from our side also, like where we should focus next, micro grants. Like there is a need for organizational development, or there is a need of, creating more opportunities and moving ahead towards the national advocacy works or community based. So what I have learned, what my understanding is that we are in kind of a mixed structure, and what we have seen that there is somewhere in some organizations there is a need to build the organizational development. There is a need to build the capacity of the staff, build the capacity of the, as Kim was sharing there. It's very hard to find researchers, even like it's super difficult.
Yeah.
So what I've learned that somewhere in some organizations there is a need to build the capacity of the staff members. Some organizations are quite equipped already, and they can move ahead like for like a national level advocacy. Some are like good towards the community support systems and community inclusion works. So what we have learned that in the next grant, what I have gathered like from all the sharings, that we'll create kind of a mix, kind of a grant where again the opportunities, the organizations will get the opportunity to work in the community as well as on the organizational development and the advocacy initiatives. So we'll try to create this kind of a structure in the next micro grant. So far, this is what I have learned, but when we compile the report, I will get like more idea. And the work so far has been like amazing. The way the reports came up from Bob, I was like, this was our first grant going out to Africa. So we were also curious, and Bob was the first one from the whole group to finish the micro grant and reporting and do the documentation. So there is like one more thing I would like to bring into the next grants, like some due diligence process also, because that is also a process which builds the capacity of an organization. And so these are some of the things which I have learned, and we'll try and we'll try our level best to see to prepare thematics for the next micro grant, and yeah, hopefully roll out in the first quarter of January 2023.
Nice.
Yeah.
Thank you. That's actually a good point, Wakar, the due diligence point, because we just finished the due diligence with one of the foundations here. That was hard, man. That was hard.
Because big donors, they do the due diligence with the organizations. Now what happens?
Right.
Now when we'll not go for like super complicated process. No, not at all. Because we cannot stress out the organization. We'll do something. We'll start with small steps. And we'll build the capacity slowly. We cannot build the capacity on one day, like go on a massive and a super complicated due diligence process.
Right.
Just some registration certificate, some small, but have clear documentation on that. Mostly like having documentation, because sometimes organizations, they lack in documentation. And it was so good to see all those reports coming up on Citans. Kim did a Thai version and then translated into English version, so she can use it and then in English. So that's something really nice.
Bravo, Kim.
Thank you.
We'll try.
I'm really impressed from Miasa's team. They are like great in designing and presenting the work. Super awesome. And also on the community inclusion works, they're like amazing. IMHA team doing already, they have a massive team now. Like if we talk about IMHA is like, they have a good team. They have like provincial teams now as well. And they are good to go with the other advocacy related works. So yeah, Yeah. So this is like, so we are trying to, move in a way like we can take everyone together, because we are one movement. We are all together. We are one organization. We are, yeah. So we'll just move ahead with true spirit and motivation and support for each other. That's what I just wanted to share my thoughts. Yes, Richa.
Yeah, thanks, Okar. Just like one thing that really came out to me when I was reading the reports, and I've been reading the reports for quite some time now, that everybody I'm hearing is that, research was like a new area for every organization to do it independently. And I know that research is usually restricted to the academia, fraternity. It's supposed to be a very technical process. Not everybody can do it. Everybody, kind of needs that kind of help with their research fits. But for all the organizations, all 6 of them, to do this work and to come out with these reports and the policy briefs, the papers that have been developed out of it is fabulous. Like, because I couldn't, like, I do understand the limitations of not knowing how to do a research project, but it did not reflect in the reports. It did not reflect in the policy briefs. So yeah, I just want to say that, like, that was my reflection, and big congratulations to all of you. It's really good. Yeah.
Thank you.
Thank you, Richa. Thank you so much.
Thank you.
Okay. So
Okay. So yeah, Fiza has joined us like just this week, and she will.
Oh,
Yeah, she's learning now. She's a Fiza. Like, if you want to share something, you're happy to share. Like, you must get an opportunity to share.
I just have to say that all the work that you guys have done, it's inspiring, and you guys keep mentioning that it was very short time, and if you've done that in very short time, it's amazing. I'm still learning, and it was good knowing the work that you guys have done. So great, thank you.
Yeah.
and
Fiza will be-
Wakar,
yeah.
sorry, Waka, I remembered what I wanted to say earlier when I went to Bali in 2018 is I remember Bhargavi saying, or was it in Bangkok? She said, if you don't know how to do something, learn it. So that was what happened. So I always remember that, she said, don't hire people. Don't ask other people to do it. Learn it. You guys can do it. You don't know how to do accounts, because she specifically mentioned accounts, finance. If you guys don't know how to do it, don't hire an accountant. Do it yourself. Learn it. I was like, okay.
because once you learn it, then you can do anything. Like, you can ask anyone like to do the accounts, but before that you have to learn it.
Right. So yeah, so that was.
Thank you, guys. It was wonderful meeting you all today. Thank you so much for
Yes.
So nice.
Thank you very much.
Yeah. Thank you,
Good job,
Melly.
everyone.
Bye.
It's good to see IMHA new people.
Get to know you, Richa and Fiza.
Yep.
Yeah.
Thank you.
Thank you.
Thank you. Thank you, everyone. Take care.
We'll be in touch.
Take care.
Take care.
Bye-bye.
Bye.
Yeah. Bye.
Waka, don't forget to send me the connection to UNCRPD.
I will do that.
Thank you. Thank you.
Take care.
Okay.
Okay, bye. Every time. Get to know you.